Going to speak about the ankle now and how what are the muscles involved in the movement around the ankle, which you know may know what the ankle is involved for the plantar flexion and the dorsiflexion. The we'll be discussing now for the plantar flexion. So what are the muscles? The range of movements of the plantar flexion is 0 to 45 degree. And the muscles which are involved in responsible for the plantar flexion, the main muscles is the gastrocsoleus complex. So the gastrocnemius is comprised of the medial and lateral head. As you know, the medial head will be arising from the medial side of the femoral condyle, the supracondylar area, and the lateral head will be arising from the lateral part of the femur. And we will blend with the soleus, which arises from the fibula, from the head, and on the soleal line. Both will blend and form the tendo Achilles. So the nerve supply of this muscle will be the S1 and S2, the myotome, which is the tibial part of the tibial component of the sciatic nerve. So now in this test, a few requisites which you need to know is that you have to ask the patient to be in the standing position to test a grade 3. So for grade 3 onwards, the patient has to be in the standing position. The next thing is you have to support his hand, or you can support the 2 fingers. Okay, you have to instruct the patient first but he has to keep the knee extended. He has to clear the ground with the heel. Okay, so first you show the patient what you're planning to do always. So you clear the heel, keep the knee extended with you standing on your tip, and try to bring it up and down. You go up and down. Okay, so once you understand, but keeping the whole movement of keeping the knee extended and going up and down on your tip. Your tip should be off the ground, your heel should be off the ground, the knee extended up and down. If you're able to do this, what is itself doing, if he's able to do more than one, it's a grade 3. So now the grading here is a bit different. If he's able to do this, you ask him to try to do 25 times. He's able to do 25 times without any fatigue, it's a grade 5. If he's able to do this between 10 to 24, that will be a grade 4. If he's able to do this between 1 to 9, it will be a grade 3. Now we'll ask him to do the same. So could you just try to clear the ground off? Okay, the heel off the ground, standing on your toe. Keep your knee extended. Don't flex your knee. Okay, try to do it. Okay, so you can see without any fatigue he's able to do this. So assuming what he's doing, based on how many times he's doing it without any fatigue, you can grade the power. In a grade 5, it will be between more at 25. Anything less than 1 between 10 to 24 will be grade 4, and less than 10, but more than 1 is a grade 3. Now, assuming he's not able to do that, we'll have to grade to grade 2. Now, the grading in grade 2 is very different. We have 3. Grade 2 is divided into grade 2 plus, grade 2 and grade 2 minus. The grade 2 plus can be again tested in the same position, where you ask the patient again to clear the ground, clear the heel off the ground, but he's not able to stand on his tip toe, on his toe. So he's able to just clear the ground, the heel off the ground, but he's not able, with the knee extended, but he's not able to keep to stand on the tip of the toe. So that is a grade 2 plus. So now, even if you have a grade 2 now, you can put, there is a prone position test. So you ask the patient to lie in the prone position. Another prerequisite in the test is that you have to ask to keep the leg off the bed. Okay, so in this, what doing this is you hold the distal part of the leg, you give a resistance to the foot. Okay, and then you ask the patient to point the foot towards the ceiling up. Okay, if he's able to give a good resistance, but it will be 2 plus. As I told you, can do the 2 plus in standing position. You can do the 2 plus. You can do the 2 plus in the lying position. Okay. So after that, you will be doing that. So if he's not able to give a maximal resistance and hold it in the maximal resistance, you ask him to do the range of movement. Will you point your foot towards the ceiling? If he's able to do the full range of movement, he's a grade 2. If he's not able to do it, if he does in between, it will be grade 2 minus. Okay, that is a grade 2. Now when the grade 2 comes, you come to the grade 1 and 0. Okay, so in the grade 1 and 0 again, you ask the patient, you feel either you can palpate at where the belly of the muscle, or you can palpate where it becomes the tendo Achilles. So for this, we show the tendo Achilles. We'll ask him to point over the ceiling and feel for any contraction of the tendon. If not, you can feel for the belly where the gastrocnemius is and feel it is. So what will be your grade, if any contraction, grade 1, if no contraction, grade 0. Yeah, fine. In this previous test, we have discussed the gastrosoleus complex. But how to test for the gastrosoleus complex. But this time, in the plantar flexion, if you want to isolate a muscle like the soleus, we can still do it. That is the same thing we apply by the standing position, like holding the hand. But this time, we ask the patient to flex the knee, because by flexing the knee, it overrides already the action of the gastrocnemius, not there. Only the soleus will be there. Clear off the ground and standing on the tiptoe, keeping the knee flexed, try to go up and down. If he's able to do this 20 times, it's a grade 5. If he's able to do it between 10 to 20, is a grade 4, and less than 10 will be, and more than 1 will be grade 3. Okay? So now the same thing, you ask for the grade 2 and grade 1, you ask the patient to be in the prone, position. Now, like last time, we asked the knee to be extended. Again, the same basis. Keep the knee flexed to 90. Okay? And by keeping the knee flexed, we ask him to give a maximal resistance of the metatarsal and ask him to bring the toe towards the ceiling. Could you bring the toe towards the ceiling? And you feel for the contraction of the soleus. Okay. What is a grade 2 plus? A grade 2 would be no resistance. Ask him to bring, could you bring your toe towards the ceiling? Only the toe. Yes. If he does that, it's a grade 2. If he's not able to do, only partially he'll be able to do it, but it will be a grade 2 minus. The same thing, now if he's not able to, you bring it to the 90 degree and you ask him to try to attempt putting the toe towards the ceiling and feel for the contraction of the soleus. If the soleus is contracted, it's a grade 1. If it's not, it's a grade 0. Yeah. We're going to discuss about the ankle dorsiflexion today, and the range of motion of the ankle dorsiflexion is 0 to 20 degree. What are the muscles involved in the ankle dorsiflexion? You have the tibialis anterior, you have the extensor digitorum longus, the extensor hallucis longus, and the peroneus tertius. The tibialis anterior originates from the lateral surface of the shaft of the tibia. It goes and attaches the base of the first metatarsal and the medial cuneiform, the plantar and the dorsal surface. The nerve supply of this for this myotum will be the L4, L5, S1, which is a deep peroneal nerve of the common peroneal, deep peroneal nerve. So, how do we test for this? Is first some prerequisites. The examiner has to be sitting on the side of the affected limb. Patient should be sitting. His heel should be placed on your thigh. And you have to clearly instruct him in the grade 3, starting with the grade 3, but the plant, as you know, the tibialis anterior is mainly a dorsiflexor and an inverter of the foot. So what he has to do, he has to bring his ankle towards me, and basically ask him to bring up and inwards. So could you bring your foot upwards and inwards? So if he's able to do this, as you can see, a dorsiflexion with an inversion of the foot, it's a grade 3. Now, you want to test a higher grade is you do a grade 5. So how to do a grade 5 is, again, the same thing is you're gonna instruct the patient, but don't allow me to bring it down and out. So I'm gonna give a downward force to counteract the dorsiflexion and an outward force to counter the inversion. So he has to give me a resistance. So as you can see, he's giving me a resistance. I can feel for the power of the muscle. So what is a grade 5? And he holds it in maximal resistance. Anything less than that will be a grade 4. Now in the grade 2 here, again, the same position, we ask the patient to try to do the movement, again, to bring it up and inwards. But he's not able to do it. If he's able to do partially and not the full range of movement, against no resistance, a grade 2. Okay? Now for the grade 1 and the grade 0, again, it will be done in the sitting position. So in the grade 1 and grade 0, but it's very important to know your origin of your muscle, okay, and as it courses. As you can see, it courses from the lateral surface of the tibia. It goes all the way towards, in a diagonal fashion, oblique fashion, to the base of the first metatarsal and the cuneiform bone, medial cuneiform. So in that way, so what you do is you have to put one hand and feel for the tibial shin, just lateral to it. That is where you feel for the belly of the muscle. And as it goes down, it becomes a tendon. So you can hold about 1 centimeter above the angle on the medial side. You ask the patient to try to do the same movement to dorsiflex and invert. If you try for any, you can feel for contraction at the belly or at the tendon. Any contraction in one of either of these will be as a grade 1, and if not, it will be grade 0. Thank you. Now that we have spoken about the ankle plantar flexion and the ankle dorsiflexion, will come to the foot inversion. The foot inverters mainly is the tibialis posterior. Along with the tibialis posterior, you have the tibialis anterior, the soleus, the extensor hallucis longus, the flexor hallucis longus, the flexor digitorum longus. But the main thing we're going to focus now is on how to test for the grading for the tibialis posterior. The tibialis posterior, as you may know, arises from below the soleus line on the posterior aspect of the tibia, and it goes and inserts on has many insertions, the main one being the tuberosity of the navicular bone. The myotomy we're going to test now in the foot inversion is the main one in the foot inversion, the tibialis posterior. What we're going to do it. So the myotomy for this will be the L4 and L5. Sometimes it is supplied by S1, but as a rule we'll take L4 to L5, which supplies the tibialis posterior. So how do you examine the test? Again, patient is in sitting position. You're sitting on the affected legs, the heel on the thigh. Okay. Now you're going to instruct the patient to bring his foot inwards and slightly down. If he's able to do this, that is a grade 3. Now we have to go grade 5. So grade 5 is you're gonna try to give a downward force and outwards while he's trying to bring the foot up and in. Mainly inwards. Okay. So what will be, if he is able to do this, is holding maximal resistance will be the position after maximal is a grade 5. The grade 2 now he's able, ask him again to bring it inside the foot, but he's not able to do it fully. So what will be a grade 2? Now for the grade 1 and grade 0 is where do you palpate for the contraction. So as you know, it arises from the posterior aspect and it comes to attach in the navicular, which is on the medial, which is a bone on the medial aspect of your foot. So feel for your landmarks. One is the malleoli, the medial malleolus, one is on your navicular. Okay. The midpoint of this, in between this, and also just above the malleoli, put both your hands. Ask the patient to try to attempt to inwards the foot. Okay. Feel for the contraction. Any contraction of the muscle will indicate that the tibialis posterior is still contracting, which is a grade 1. And if it's not contracting still, it is a grade 0. Thank you. We're going to test for the flexion of the hallux and the overtoes here in this test. As you may know, but it's the myotomy we're going to test is the L5, S1 and S2. It is very important that everyone knows this, is because in the spine cases, usually it's any motor deficit usually present in the L4, L5, S1, S2. So in this we're going to focus on the L5 and S1. How are you going to test the myotomy for the L5, S1, S2? So for the toe, it's mainly the L5, S1, S2 is mainly the muscle which are the flexion of the toe, and for the toe, including the big toe, will be mainly your flexor hallucis longus, your flexor digitorum longus, and your flexor digitorum brevis. So patient will be lying in the supine position, and the heel will be off, and we'll ask the patient to try to bend all the toes, only the toes, without bending the ankle towards the ground. So asking him to do that. If he's able to do this with no resistance, it's a grade 3. Now, given he's doing it, I'm going to stabilize the foot on the dorsum, okay, just below the malleoli, and with my thumbs putting my thumb either at the distal line or just below the proximal phalanx. I'm going to ask him to do the same thing, now giving a resistance upwards while he's bringing only the toe downwards, because I'm stabilizing proximally the foot, so I'm eliminating any plantar flexion from the ankle. So if he's giving me a good resistance, a grade 5, holding it in maximum position. Anything less than that, it's a grade 4. Now if the patient is not able to do the grade 3, he's able to do a partial movement, then what will be a grade 2. Now for the grade 1, the same thing is stabilize and ask the patient to try to attempt giving your hand below, your thumb below the proximal phalanx. So you can feel for the tendon for the flexor hallucis longus, just at the proximal phalanx of the grade 2. If there's any contractility will be grade 1, no contractility will be grade 0. Thank you. So we're going to discuss about testing the grades of the power of the muscles of the foot now. Coming to the foot, so we're going to do the motion for the range of motion for the flexion of the metatarsophalangeal joint and the IP joint, especially of the hallux and the foretoes. So for the flexion of the MP joint of the foot will be involved the lumbricals will be there, and also the flexor hallucis brevis. So I'm going to teach you how to do. So the myotomy we're going to test between the L5, S1, S2, S3. Okay, the L5 and S1 will be the first lumbrical, whereas the S1 and S2 and S3 will be the next fourth lumbrical. So patient should be in the supine position. Obviously, the leg at the hanging free. Gonna instruct the patient one hand to stabilize just below the malleoli, the ankle, stabilize the ankle. Use one hand, one finger to just place it beneath, palpate for your proximal phalanx, okay, where your flexor hallucis brevis comes and attach it. We're going to test for the movement, the grading for the flexor hallucis, for the flexion of the big toe, which is by the flexor hallucis brevis. So just beneath the proximal phalanx and slightly on the sides, because later I'll tell you the basis of this. Ask the patient to flex, to bring his toe down towards the, okay? So if he's able to do this without any resistance, will be a grade 3. And giving a resistance now will be a grade 5. Holding it against maximal, in the maximal position against resistance, a grade 5. A grade 2, he'll be able to do it, but he won't be able to completely do the full movement. Whereas in a grade 1 now, the same thing as I said, I told earlier, is while now placing beneath the proximal phalanx, you just make sure that the tip of your fingernail also is on the side, because that is where the attachment of the flexor hallucis brevis is. So while he's trying to attempt to flex the toe, I can feel for the contractility of the flexor hallucis brevis. If it's contractile, it will be a grade 1. If it's not, it's a grade 0. Now the same thing we're going to do, we're going to test for the lumbricus. Now the lumbricus will be involved for the metatarsophalangeal flexion of the foot. So same thing, stabilize, patient is in supine, stabilize the legs hanging free, stabilize the angle. The hand now will be underneath the metatarsal, palpate for the metatarsal and the plantar surface, and then ask the patient to bring the foot down. Okay, against no resistance, if he's able to do the maximal function, is a grade 3. Against resistance and holding it in maximal position will be grade 5. A grade 2 will be partial movement. A grade 1 now again, you will feel for the contractility of the lumbricus. Now whether you can separate, identify each lumbrical, is there a specific test for this? No, it is not feasible to separate each lumbricus. So that is how you do the flexion of the NP and the hallux. We're going to test for the flexion of the hallux and the overtoes here in this test. As you may know, but it's the myotome we're going to test is the L5, S1 and S2. It is very important that everyone knows this, is because in the spine cases, usually it's any motor deficit usually present in the L4, L5, S1, S2. So in this we're going to focus on the L5 and S1. How are you going to test the myotome for the L5, S1, S2? So for the toe, it's mainly the L5, S1, S2 is mainly the muscle which are the flexion of the toe, and for the toe, including the big toe, will be mainly your flexor hallucis longus, your flexor digitorum longus, and your flexor digitorum brevis. So patient will be lying in the supine position, and the heel will be off, and we'll ask the patient to try to bend all the toes, only the toes, without bending the ankle towards the ground. So asking him to do that. If he's able to do this with no resistance, it's a grade 3. Now, given he's doing it, I'm going to stabilize the foot on the dorsum, okay, just below the malleoli, and with my thumbs putting my thumb either the distal line or just below the proximal phalanx. I'm going to ask him to do the same thing, now giving a resistance upwards, while he's bringing only the toe downwards, because I'm stabilizing proximally the foot, so I'm eliminating any plantar flexion from the ankle. So if he's giving me a good resistance, a grade 5, holding it in maximum position. Anything less than that, it's a grade 4. Now if the patient is not able to do the grade 3, he's able to do a partial movement, then what will be grade 2. Now for the grade 1, the same thing is stabilize and ask the patient to try to attempt giving your hand below, your thumb below the proximal phalanx. So you can feel for the tendon for the flexor hallucis longus, just at the proximal phalanx of the grade 2. If there's any contractility will be grade 1, no contractility will be grade 0. Thank you. So the last part of this series will be focusing on the extension of the metatarsophalangeal and the hallux. And which are the muscles which are involved in this? It will be the extensor hallucis longus, the extensor digitorum longus, and the extensor digitorum brevis. With myotones are mainly the L5 and S1, but also involves the L4. So L4, L5 we're testing for this now. So in this, how we're gonna do is patient can be in either sitting or supine. So supine position with the legs hanging on the freely. One hand you stabilize the ankle, and here your thumb on the dorsum of the foot, okay, are shown, and your fingers below stabilizing the metatarsal. So the patient will have to bring all the 5 toes up towards the ceiling while I give a resistance. So no resistance, if he's able to do it, is a grade 3. Giving a resistance and against the resistance, holding the maximal position is a grade 5. Not able to hold the position of against the maximal resistance, it is a grade 4. A grade 2 is he's able to do partially. Okay. Now the same thing is again stabilizing while he's trying to attempt to lift the toe towards the ceiling. Feel for any contraction of the muscle. So the extensor dilatum longus and the extensor dilatum extensor hallucis longus can be clearly seen on the dorsum of the foot. Any contraction you will feel will be grade 1, no contraction will be grade 0.